Hey everybody, welcome to my podcast show called Health Beat. My name's Brian Hazelgren, and this show is all about topics related to health and wellness and developing a positive lifestyle. We discuss topics about healthy living, and the show is full of ideas, innovations, science, and discussions with experts for the very best possible solutions to take care of your body and mind. It's time for you to feel better and look better and learn more about what's out there to help you achieve better health and wellness. I'd like to thank you for taking the time to listen to Health Beat. Let's get started. Well, hello and welcome to another episode of Health Beat. My name's Brian Hazelgren, and we have another cool show lined up for you today. And today we're going to be discussing something that we have been researching now for quite a number of months and actually years. And it's something that's near and dear to my heart, but it's I think you'll understand it better when we get into it. We're going to be talking about telehealth or telemedicine, virtual healthcare, remote healthcare. Those are some of the names that's been given to this particular topic. And we've got some really cool things to share with you. You're just going to have me today. We'll have other guests on. I wanted to keep this topic moving forward and at least get this kicked off and started the right way. And then we'll have some more guests on the future shows. So, but welcome to the show for now. So let's get started on this very important topic. And let's talk a little bit about remote primary care. I don't think it's a mystery that healthcare costs continue to soar. At the same time, patients have shown a really strong interest in wanting to have healthcare be more convenient for them and obviously more cost effective. So today I want to cover the potential for remote primary care and how that transforms literally the healthcare landscape. Because since the worldwide pandemic, lots of companies have come into the market. They've offered virtual healthcare or telemedicine. Some are thriving. We happen to also have developed a very cool kind of futuristic telemedicine device that I think you're going to love to hear about today, and how while you're on the road or in a remote area, or you're traveling somewhere and you just need to talk to a doctor, we've got what we call our Robo Rita. I'm going to introduce that topic to you as well. That's our telemedicine platform. But, you know, we as patients, we want to make our healthcare more convenient. We want to make it more efficient for us. We want to have it more cost effective for us as well. So today we're going to talk about patients who also use remote primary care instead of utilizing or going to the emergency department or urgent care facilities. You've probably all heard of that before, but we'd like to explore some of those insights from a recent journal from the Journal of Health Economics, and also another research paper from Stanford University, and some of our partners that are with us on the remote primary care program. We're going to talk a little bit about what they've done as well. So we'll learn how remote primary care with real physical exams can improve our outcomes as patients, can enhance that patient experience with a medical professional, and also help patients save some money. So I want to introduce to you the Robo Rita. You're probably wondering why'd you name her Rita? Well, first of all, she looks like a robot. But Rita stands for Remote Intelligent Telehealth Assistant. And this was a product that was created by a good friend of mine and one of my business partners, Kishore Joshi. And he had a dream that he wanted to allow patients to actually experience virtual healthcare, but do it remotely with a kind of a fun little device. So he designed and developed the Roto Rita program, worked really well while it was on college campuses. And then for one reason or another, when they took those off location, they were doing really well, but it just wasn't, it was before its time. And so we have worked together now here for quite a while. Kishore and I and our team members have built something that's pretty cool, pretty interesting. You're going to like it. So, RoboRita is literally the first AI telehealth platform and health and wellness ecosystem. We call it an ecosystem, and you'll learn why more in just a minute. That it's available for travelers who are on the road, people who live in rural areas, patrons who visit locations outside of away from their home or their home base, and they would just want to talk to a medical professional or even a registered dietitian. We're going to talk about registered dietitians too and how they can help patients with this platform. So Rita, like I mentioned, was an idea that was developed and designed by Kishore Joshi, brilliant man. He and his team put together a virtual care solution for the patients. Allowed the patients to talk to a medical professional 24/7, so anytime, anywhere. But then it really got put into the warehouse, and the funds weren't available to continue manufacturing. Lots of reasons, but now we've basically redesigned the whole system. We put our minds together with our team members, came up with a new design, made it look more sleek and modern. Found a couple of great manufacturing partners to help us build the perfect virtual healthcare device, along with our software team. And after months of trial and error, the units are now getting ready to be delivered to locations throughout the US. So we're very excited about this. So we created the devices to allow patients to speak with a medical professional 24/7, really anytime, anywhere. But as you've heard maybe on commercials before, but wait, there's more. There is. The units also allow for videos or advertising to be displayed if the unit is not being utilized. So it becomes an advertising tool as well. And patients can also order wellness products from the devices if they'd like to order any of those through our online store. So these virtual healthcare devices serve a lot of purposes. And we also have a lot of partners in the program who are working with us on the financial side. So if you'd like to look at an opportunity to be a partner with us on this, I can chat with you about that at another time, because it is producing revenue, multiple streams of revenue that you'll want to know about if you're looking for maybe a passive opportunity to be involved in a business that we have with the RoboRita devices. So anyway, for now, let's continue talking about why we created this program, why we created this device. And let's also talk about how virtual care or remote care reduces costs, not only for the patients, but also the payers, the insurance payers who have to pay for the healthcare bills. But it's also improving healthcare access and outcomes. So we all know that the escalation of healthcare costs has created a significant strain on budgets. The need for innovative solutions has become very apparent. That was very apparent to us. That's why we designed this whole system. Virtual care has been gaining traction literally since the pandemic, where people could not get out or couldn't get to see their medical professional or whatever the reason was. But since the pandemic, we've had to take a hard look at how virtual healthcare can actually make it more convenient, make it less expensive, reduce costs throughout the system, and also literally help people get better faster, maybe even save some lives. So what are the benefits then? Virtual healthcare has the potential literally to alleviate overall healthcare burdens, and also having a significant impact for the payers, the entire system, and like I mentioned, the patients. And when you do it right, virtual care, remote healthcare can really reduce the costs two factors here that if I mean, let's face it, emergency departments are expensive. We don't want to go there. They're ridiculous in what they charge for. And same with urgent care visits. In our studies, we looked at urgent care facilities. I saw some in the northeast part of the country, $400 a visit. The average around the country is $180 per visit. That's pretty expensive. Well, what if we could reduce that cost to the patient and also get their needs taken care of, and also help lower hospital readmissions? And virtual or remote healthcare also helps ensure that patients have timely access to care, can improve health outcomes, and can lower the their own healthcare costs in the long run. Part of our research showed that there's a lot of people who are interested in virtual healthcare. In fact, when you look back in 2023, there were over 28 million patients in the US that use virtual care. That's 28 million virtual care users or telemedicine users for their healthcare options. That was one thing that stood out to me, is that this is growing. It's a growing industry. So but how can I put this? We wanted to offer virtual care and make it as a solution that not only help the payers to retain more of their patients, but again, we also wanted to help the patients who need medical assistance with a medical professional. They may need dietary assistance or nutrition advice. They might need exercise regimen information. We've got that available now through this particular program, through RoboRita. But I want to caution you to look at, not all healthcare, especially virtual healthcare, is created equally. We go beyond the traditional, I've got a sore throat, what do I do? Or we can now actually look inside the throat through this device as you're standing in front of it. There's a very powerful, very expensive 4K camera that's inside each one of these devices of the RoboRita. So physical exams can be done literally as the patient standing in front of the device. By the way, again, so I just want to make sure you remember what RITA stands for. It stands for Remote Intelligent Telehealth Assistant. Now, I mentioned something earlier that it's an entire ecosystem. Let me just name off to you why we call it an ecosystem. First of all, it's a national network of medical providers, cover all the 50 states. It's virtual healthcare or remote healthcare, as we've been discussing. You can even choose healthcare plans while you're surfing the store, or want to know more about particular healthcare plans that might be available to you. Those are available through RITA. Your prescriptions can be refilled or first time written while you're on the road and actually delivered to wherever you're going to. There's an online story. There's a lot of wellness products that you can order. There's nutrition guidebooks. There's supplements. There's wellness coaching. You can talk again directly to even a registered dietitian about diet, nutrition, and exercise. You can, if you're not in front of the RITA, guess what? You can also use our app. You don't always have to be standing in front of the RITA. We've got partners who also allow us to use the wonderful care of our medical professionals. It's really cool to be in front of the RITA, but it's also available through the app. And that tags you back to the original RITA that maybe you signed up on, which is also a really good thing. Plus, you can also look at different wellness products. So this ecosystem of RITA is alleviating the cost to the patient. It's helping provide more patients to the providers and to the payers. It reduces pressure on the payers and the providers, and it also is very convenient. So let me just tell you of a couple of stories that we've heard about through through one of our partners, a couple of our partners actually, where the people have given testimonials about virtual healthcare. One gentleman said, I can't underestimate the value of not having to go to drive to an urgent care center, sit in a waiting room with other sick people, and wait to see the physician, sometimes hours on end. This remote healthcare model is much more efficient and reduces our exposure to any infectious disease that might be out there. Kind of important. He went on to say that telehealth has really enhanced his relationship even with his healthcare providers. It's unique in the marketplace that we can get a telemedicine visit using this type of device, like the RITA program, that allows for the physical exam and other physical elements to be captured in a way that improves the quality of the telehealth visit itself. And he also went on to say that I think the kids would definitely say if they were here, they prefer the RITA visit over a visit to the pediatrician's office. Also, a nurse practitioner named Brittany, she wrote in and said that telehealth visits close the gap of being virtual. It lets patients feel like they're in the clinic and lets us get a close look without really having to be there in person. It provides a more accurate diagnosis and better healthcare access without the hassle of the system today, and it provides a lot of peace of mind for my patients. Okay, I like that. What about the business impact? Now, I mentioned when we started this, we'd cite some articles from Stanford University, also the Journal of Health Economics. But I also want to emphasize that through this system that we have, it's not just the device, it's literally the system of New Wave Medical Network and the providers across the country that actually take those phone calls and talk to the patients. It's the Protexa AI platform that runs all the data and collects all the information and makes it all HIPAA compliant. And if there's billing that needs to be done, that's all taken care of as well. And then TitleCare can deliver additional solutions away from the RITA device through our partnership with them. So TitleCare has actually done a lot of additional research that I wanted to point out to you that might be of interest to you, where the Journal of Health Economics, they published a paper about researchers and information about TitleCare, which was great to hear because they're a partner. The study found that the telemedicine directs patients to the right side of care, as it stated here. As a result, TitleCare was able to reduce emergency department use by 24%. That's a lot of money that's being saved. Can also cut the cost of care by 9% in adults and 7% across all age groups. This is accurate as well. So this was a statement that I thought we all should be aware of, especially when it comes to remote care and virtual healthcare visits. Accuracy and visit resolution are vital measures of the effectiveness of virtual care. So let me say that again. Accuracy and visit resolution. So in other words, getting something resolved while you're talking to the medical professional. Those are obviously very important. And TitleCare has done some research that has literally shown that 98% of visits that are fully remote, that aren't in person, but 98% shows a virtual resolution of what's ailing the patients. They go on to say that 59% of additional conditions were accurately diagnosed using telehealth services. Now, we found that patients utilize virtual care up to 10 times more than traditional healthcare. 67% of patients said that having telehealth options available to them makes them more likely to stay with their provider and their insurance program. 81% of patients claim that telehealth apps help them stay on top of their overall wellness. And today, over 80% of doctors in the US are using telemedicine. Okay, this currently it's a growing industry. It's a $159 billion industry. And the statistics that we're seeing and that I'm staring at on my screen here, this industry in the telehealth or virtual healthcare space is expected to surpass 580 billion by 2030. So it's working, and outcomes are working, are being improved, and additional services are being offered. So let me just go over a couple of things here that might be of interest to you that I think you'd like to hear about. Virtual visits through telehealth options like our RITA program, they minimize unnecessary trips to the emergency room, and they lower hospital readmissions. I think I've mentioned that already, but I think it's worth noting that that's helpful for the patients to be able to have a diagnosis and a resolution taken care of before they have to step inside of an ER emergency room or being readmitted back into the hospital. So it's also a way to help prevent disease progression. Telehealth services reduce the long-term costs associated with managing advanced conditions. And telehealth solutions are also streamlining the healthcare delivery process, which enables the provider, the doctor, to see more patients in a day. It's also resulting in higher revenue streams for the healthcare facilities and for our doctors. Virtual care also lowers the cost associated with in-person visits. There's also no high co-payments. There's no transportation costs. There's no time off work. And there's no facility expenses. So these are very efficient. In fact, if you're listening to this episode today and you work for a company that has a medical facility on your campus, we'd love to chat with you because we have a way to save enormous amounts of money and costs, either building or then maintaining and staffing that medical facility on your campus. We've got some ways to help, and that I'd love to chat with you about offline. So these savings are really critical to the patients and the companies. Maybe if it's part of your corporate wellness program, the RITA device is a great way to save just so much money with your wellness program that you just need to know more information about that and chat with us about it, because it definitely is something that is very it's working very well, and that there are more companies that are coming to us that it's just too expensive to keep those medical offices open and staffed properly, even after it's built. Anyway, we've got a way to help you with that. So telehealth services enable timely interventions that lead to improved patient healthcare outcomes. And through our RITA program, we can also help with better adherence to treatment plans, even such plans like diabetes and asthma monitoring. You can chat with a doctor. You don't have to wait 26 days. I don't know if I pointed that out yet. I don't think I did. But the average wait time in the US is 26 days. 26 days to see your doctor. Well, why wait 26 days? You can wait a couple of minutes and you can be connected with a doctor through the RITA system. So it's immediate. And if you sometimes have to wait longer, that can also cause other problems. What about people in rural areas? This is a very convenient way to get to the doctor, even if you're up in the northern part of the US where you get snowed in sometimes, or down the Southwest where I live, where it's too blazing hot in the summertime to get out. Well, what if you actually and have to wait? Especially when we go back to the snowy countries, especially if you're not feeling well and you don't want to be driving in icy and wet conditions. Anyway, the RITA devices are also available to you. So if you're in a rural area, you can make connection with your medical professional in a matter of minutes, not 26 days down the road. So what does this all mean? Telehealth through RITA enhances remote primary care for you as the patient. It helps the doctors even get to their patients faster and even drive more opportunities to meet with them. It also saves time and money while contributing to better outcomes. It's way more convenient for patients to tap into. And they're not just sitting in a waiting room for several hours sometimes, maybe even with other sick people. That doesn't happen. Um, and I mentioned earlier that you can also talk to a registered dietitian. So if you're interested in chatting with someone about diet or nutrition, losing weight, your exercise regimen, they're also part of the entire RITA program. So that's something that you'll want to be aware of. Now, before we wrap up here, I also want to make sure that you're understanding where you can get more information. So you can go to roborita.com. That's ROBORITA.com, roborita.com. You can also check out any of this information about RoboRita on Truckers Health Network. Of course, we want to make sure that we're always taking care of our truck drivers throughout the country. Want to keep them safe. Want to keep them on the road. That's why Truckers Health Network was started as a corporate wellness program for them to tap into. You can also go to truckershealthnetwork.com, learn more information. And to really, I mean, we're all stakeholders in the healthcare system that we have in our country. We're all patients. We all get sick. We all need a medical professional, a wellness coach, a registered dietitian sometime in our life. So all of us should be encouraged to start adopting and utilizing virtual care. It's also helping to save a lot of time for the doctors, where maybe they actually do need to see more people, and we want to help ensure that healthcare is also more affordable, that it's efficient, that it's accessible for all. You can do that through Rita. It's either a cash pay visit. You can even use your insurance, as long as the provider on the other end allows for that to be taken. But there's so many different options for you, and I think you're going to start seeing a lot more in the future when it comes to virtual healthcare, remote healthcare, telehealth, telemedicine. I just wanted you to be aware of it now, and then in the future, future episodes will have additional people coming on that are actually partners with us, that will have medical professionals on to tell you a little bit more about what great things that we're seeing here. But anyway, I wanted to wrap up for now. Thank you again for joining us today on Health Beat, and for taking some time out of your busy schedule to listen to all these fun statistics and all this great information that we're providing for you. Now, I know we've learned a lot. There's more that you can get a hold of us either through the roborita.com platform or website, or you can also learn more about us on truckershealthnetwork.com. But nevertheless, you've been tuned into Health Beat today, and I want to thank you for being a part of our growing community. I'm going to sign off from now. I'm Brian Hazelgren. I'm your host. And now it's your turn to go out and take this great information and make it to your own benefit. Thanks for joining again, and make it a great week.